Hi, my name is Kyleigh Bradshaw. I was originally diagnosed with FAI about 7 years ago. I also had torn labrums, which I had surgery for when I was 14. Those surgeries did not end up working properly. They actually furthered my case and made me more susceptible for injuries in my future. I had a guest actually come into my workplace and highly recommend not only Paley Institute, but McVicker, because he was a previous patient here and he had an amazing experience.
I am here today to get my hip fixed. This will be my third surgery on my hips. I grew up an athlete, so I got pretty unlucky when I got injured at a young age. I've had 2 hip surgeries previous to this when I was 15. That was just a simple procedure, one that surgeon has done multiple times in his life. So being back here, about to go into surgery, is not something I anticipated to do again, especially still being young. I'm thankful that I found McVicker and that he's gonna get me set right, and I won't have to do this again.
Okay.
That's all I'm worried about.
All right, I'll give you my best, okay?
Thank you.
Hi, this is Dr. McVicker. We have an interesting case that is a revision hip arthroscopy. Our patient had surgery several years ago on her hip, continued to struggle with pain for many years, and is unable to play the sports and do the activities that she wanted to do. She flew down here to meet with us and finally have some answers to some of the questions that she's had for a long time about her hip and why she's not getting better. So we performed the case today, minimally invasive arthroscopic surgery of her hip. You know, little poke holes through the hip. We were able to completely reconstruct the labrum and do a capsular reconstruction, which is the ligaments around the hip. She had a lot of instability in the hip, and it was causing a lot of her pain that she continued to have with activities. So because of the surgery today, I'm hoping that she's going to be able to get back to doing all the sports she wants, like volleyball and gymnastics, and have a good, healthy hip for the rest of her life.
This procedure has allowed me to do my day-to-day activities as I normally would, but with less discomfort. Obviously, I'm still not fully recovered, but I'm really capable of things that I wasn't able to do prior with no pain. Not only can I do things like going back to the gym and simply taking my dog for a walk, but I'm able to lay in bed comfortably. What surprised me the most throughout this entire process was how much people genuinely seem to care about me here. It's something I'm honestly new to in a doctor's atmosphere. My previous surgeon was not super caring, so coming here and from the day of the surgery to every single one of my physical therapy appointments, having somebody that truly wants me to get better was very surprising, unfortunately. Kim has been absolutely amazing at every physical therapy appointment, from not only making sure I'm doing everything right, but making me feel comfortable in this atmosphere when I'm in so much pain. However, I definitely made her job a little difficult at times, but she was always a trooper. At the end of the day, I really just want to thank the staff here, from Dr. McVicker and Liam. Those two really helped me in the beginning, understanding why I needed to have this operation, as well as Lisa for all of the phone calls and all of the things that she helped me with. Really, honestly, the main thing, and I mean this from my heart, is those 2 surgeries I got 7 years ago. If I could redo that, I would do it here at the Paley Institute with Dr. McVicker 1,000 times over. I am getting my life back thanks to his operation.